Blue Physiotherapist. It's only fair we give chiropractors a chance on the program to make their case. Dr. Saurabh Mangal, Director of Health Science Physio Wellness Clinic, is also with us. By the way, all the details that you're seeing on the report are actually by our colleague Himani. You can watch and in fact, read the entire report on news18.com as well. So, Dr. Saurabh, let's start with this. Chiropractic not to be recommended. People are going to physiotherapists after things have gone wrong with the chiropractor. All these claims have been made. So let's give you an opening comment first to make your case.
Okay, what I'll say that people are coming to us not because they have done the things incorrectly in the chiropractic clinics, but they come because it is not benefiting them.
Okay.
So people come to us and they say we went to the chiropractor for back pain, we felt the relief for just 10-15 minutes and once we came out of the clinic it was same. So there was no relief. That's why they come back to the physiotherapy.
But Dr. Mangal, if we could ask you, you are also a chiropractor, correct? You are someone who has been practicing the chiropractic science for at least the last 7 years.
Also doing physio. He does both.
Also doing physio, exactly. But that's exactly what Dr. Kannan said earlier, that chiropractic as a science is practiced by those who are physiotherapists who then take this up. Why did you decide to take up chiropractic after being a physiotherapist for many years? What was your shift there?
In physiotherapy, we get lots of patients with the different problems. Our main job is to let them get out of that pain position by using different kind of modalities. Like we use electrotherapy, we use manual muscle mobilizations, we use stretchings, we use exercise therapy. Nowadays we are using dry needle therapy as well, where we use that acupuncture needles. This chiropractic thing is also a part of physiotherapy, as we can say, because these are the manipulations. In physiotherapy, we practice low volume. Like we just practice the manipulations, but not like that cracking sound. But in chiropractic, we practice in the high velocity. So if I say the both things like manipulations we are using in the physiotherapy and high velocity manipulations used in the chiropractic, they are almost same. But that low volume manipulations of the joints benefits. But this high volume just gives the relaxation. So I'll say that chiropractic part comes for the relaxation only.
So you're making the distinction very, very clear. Number one, it's an alternate therapy, does not replace physiotherapy, and it is only for instant relief, not cure. So that's important to remember. Not to see it as an alternate therapy, not to see it something that will cure altogether. It is only to give you relief, which sounds okay. That clarifies things a little bit. But my question is this: why is there so much sort of at one hand a lot of viral videos of chiropractic going the rounds, and on the other doctors saying, listen, stay away from it. When in a place like India, where traditional massage and very age-old ragda massage used to be like a thing, in a country like ours, how does this go back?
Look, people, if you see nowadays from last 2-3 years, people are more into social media. So whatever you see in the social media, if you see the reel and if you're sharing it, social media will hype that. So when people started to post these chiropractic techniques and these cracking sounds on the social media, it took hype. And now everybody is seeing the videos and they think that, okay, I'm having back pain. Let's go and try this. So people are going there by the chance. Okay, let's give it a chance. If I get benefit, it is okay. If it not benefiting me, I will go back to the physiotherapy.
But is it a chance worth taking, since there are some instances also?
So that's exactly, I want to, Dr. Mangal, I want to ask you this. I think the strongest point that Dr. Kannan, who we had right before you, he was making, is that physiotherapists are regulated. In India, there is a body that regulates physiotherapists very strictly. The same doesn't exist for this practice, for chiropractic. And so what you could have happening in many cases, which is so important because you're letting someone come in and play with your body, is that there's no regulation, and that's actually quite dangerous, wouldn't you say, doctor?
Yeah.
This is a very dangerous technique, and as we have seen it on some videos also, like there was a case, and I think it was in the USA. One chiropractor just did the manipulation on the neck of a patient, and that patient was paralyzed after that. And recently, one video was trending on Instagram that one person was sitting on the barber salon, and that barber did the manipulation of neck crack, and he was like this in that position.
right.
That was fake, but this cases happens. And in my own city also, I have seen one case in front of my eyes. I was sitting in the saloon. One man came. He said, "My neck is stuck from the morning." That time I was in school. So that barber said, "Okay, I can adjust it." And he was adjusting it from many months or years or other persons also. But that day, in front of my eye, he adjusted it. And after 30 minutes, somebody told me that man who got his neck adjusted is no more.
Oh God.
So this is the real case. This is the real case in front of my eyes that I have seen in my school time. But
Right.
but if you see in India, you will see these techniques are being used in ancient times also, and like in rural villages, still people use. If somebody is having back pain, they ask them to lie down on the floor, put your leg that side, and they kick them.
Yeah. Yeah.
So this
Dr.
techniques we
Saurabh, sorry, we're running out of time, so quickly I want to squeeze in a question. You know, you seem to have a balanced view on things. You're saying you yourself do chiropractic, but you're saying not everybody does it the right way. So what's your recommendation for people? The difference between instant relief and long-term repair is clearly established. But what is your advice when people say are looking at chiropractic?
I will say this: for the long-term effects, you should go through physiotherapy only. And if a physiotherapist want to do the manipulations at the right time, that is a good idea.
Right.
Instead of just going straight to the manipulations, because manipulations can harm you. But with the physiotherapy, if you are using it, it will not harm you.
Right. All right, Dr. Saurabh, thanks so much for joining us and clarifying that completely for our viewers. Well, go to a certified one. That's my only go-to. And please take proper recommendations. And please ask your doctor before trying any of this. That's a big disclaimer coming there. Thanks so much for joining us with that.